Dr. G, what are you working on today?
This morning, I'm actually treatment planning a somewhat a difficult case. I have a young lady coming in with a missing front tooth, lateral tooth. She hasn't had a tooth, never had a tooth there for a long time. She had what we call a Maryland bridge. So basically just a bridge between those two adjacent teeth. Now that bridge broke, and so now we are wanting to get her an alternative approach, more of a long-term fix. And so looking at the case, I'm looking at her CBCT 3D scan to see what would be the best outcome for her long-term. And so after doing the CBCT, what I found is that there's not a whole lot of bone thickness, bone quality. Anytime you have a missing tooth, the chances of having a good quality thick bone for an implant is less. So what you end up, the best approach to mitigate this kind of risk would be to go ahead and do what we call ridge augmentation. It's a bone grafting technique to thicken and to improve the quality of bone so that we can have a nice prosthetically driven implant for the missing tooth. And so as you can see, the picture here, I'll show you the picture. Missing tooth, and then you can see the thickness of the bone. And so by ridge augmentation, my goal is to make the ridge reasonably acceptable for an implant so that we can have a nice prosthetically driven crown. And so that's it. That's all. This is what I'm doing. That I'm going to kind of walk you through step by step the steps we take. Every case is different. We look at every single case unique, and so there's no someone that says, well, but my friend didn't have a bone graft. It doesn't work. What works is what we have, what clinical case we have. We look at each case with the end in mind. We want to have the best outcome in mind. What that means is we look at the case. What is it that necessary? Sometimes patients, tell us, well, but I don't want bone graft. I don't want this. By doing that, you are going to get a compromised outcome. And the outcome is maybe not an implant. Maybe you get a bridge as an option. Okay, well, and so ultimately by saying no to certain procedures, you're saying yes to a compromised outcome. And so luckily, this case, our young lady has agreed to proceed with the ridge augmentation. And so that ridge augmentation usually takes about 3 months to occur. And so we go ahead and do the grafting, and then we let it heal for 3 months, and then we'll take another new scan. And so we'll be able to tell the bone growth from before and after. And following that, we'll plan our implant, starting with the new bone to make sure that we can have the implant the right size, the right orientation, the right angle, so that we have a nice aesthetically driven outcome. And so that's kind of how the process goes. So if you're missing a tooth, your doctor needs to go through all of this kind of steps for you to have a really good outcome. No shortcuts. Shortcuts don't work. Having the technology, having the 3D scan allows us to visualize the outcome before it actually happens. And so as doctors, we like to visualize the outcome. When a patient walks in through my door, whether they're missing a single tooth, whether they're missing multiple teeth, I need to visualize it in my head so that I can have a game plan. Then, by doing that, I can provide my patients the best outcome, and that's it.